We are live.
Yeah. Good evening, everyone. This is our 98th podcast. This is a brainchild of a Gyan Pravah is a podcast series which has been done for the last so many months by our president of the FOGSI, Dr. Sunita Tandulwadkar. This is a unique initiative by her because this gives us as a committee chair to interact with the eminent persons in their own field. Maybe it's not be related to the healthcare or maybe it's related to any other field which they had done their excellence in. So this is a really a good initiative, and I am as a committee chair of our family welfare committee. I am really glad that Madam has given us a platform to interact with the eminent speakers. And today there is another two eminent speakers. There is one guest, and another is the speaker who is going to interact with me. So it's my privilege to introduce to all of you our VP of this year, Dr. Palaniappan. He is also a great teacher and he is an eminent surgeon. And another important thing, whenever I will call him up, he is always there to support me in whichever endeavor I enter into. So, Palaniappan sir, I'm really thankful to you for chairing this session. And we have eminent guest to give the introduction prior of our guest. I like the Dr. Palaniappan to say a few words about this podcast. Over to you.
Good evening, Ashish and the viewers, and good evening, respected Kananelikar madam. And I'm extremely happy to be a part of this Gyan Pravah series, which has been the brainchild of Dr. Sunita Tandulwadkar, which has been going on. We are almost reaching 100th podcast now, almost. And the very purpose or the idea of this podcast of Dr. Sunita was to involve all the committee chairpersons' activity. This is absolutely the idea, and the initiative was done by Dr. Sunita, but then the chairpersons have taken it ahead and they are doing it across the country in an extremely fantastic way, as always. And Ashish has done this extremely well. And as Family Welfare Committee Chair, Ashish has done a lot of work, and this is one of his initiatives as well today, and interviewing Dr. Kannan Ilikar as well. And the idea was given by Dr. Sunita not to involve only on fibroids and breech and abnormal uterine bleeding and infertility, but you could intervene into any of them, and you can talk to the specialists in their respective field, whether it be politicians or industrialists or country heads, leaders, gynecologists, whatever, of varied fields. And so it's been fantastic to see these podcasts, though may not be in the same window going on to the viewer's view. We can view, and I most often, 90% of the times, I view this at 8 o'clock, because 8 o'clock means it's the podcast for any of the Foxians. So being a true Foxian and being the vice president of Foxy, it's been a fantastic time, and we appreciate Dr. Sunita's initiatives, and it's been beautiful watching these podcasts, because for a change, we are seeing something else other than obstetrics and gynecology also in our own field, and that is what has been fantastic. And so with those few words, without being me intruding into Ashish and Dr. Kannan, let me congratulate Ashish and welcome Dr. Kannan Elikar for this podcast. And over to you, Ashish, and thanks for making me a part of it. And thank you very much. Over to both of you for the podcast.
Yeah, thank you. Thank you, Professor Palaniappan. It was a great learning always from you. When we're talking about the today's subjects, let me introduce to all of you what is the subject is related to. The subject is a changing paradigms in the being of the well-being of the woman, achieving the success and beyond. Why I come into this particular frame of mind? Because today I'm going to interview the person whom, if we called as a Bible of a any things, is related to the woman-centric approach. You just name, she will be having n number of work. If you name the social work done by her is a humongous work. Even if you just read the biodata of her, you will realize, being a woman, she had done and she has served the many women of this country. She has received the highest award in the teaching, that is a BC Roy Award, by the President of our India. To see a few words about her, the teaching is a profession, but when a teaching is a learning, and teaching is a your atma, that the one person whom you always salute is Professor Kanan Yelikar madam. When I talk about her, and when I just gone through the little bit few what she achieved. There are I can talk about her maybe 30 minutes, but just let me the all the viewers know what she achieved in her life. She was professor and head for last 36 years in a government medical college, that is the GMC, Aurangabad. She is now a dean. She was dean in a medical college from 2016 to 2021. Nominated, shortlisted for a post of vice chancellor of Maharashtra University Health Sciences in 2016. She was elected as a president of AMOX, that is our Maharashtra OBGYN Association, and she lead and she had done the fantastic work in her tenure. She was as a vice president of our federation in 2007. She worked as a committee chair of the FOGSI in clinical research in 2004 and 2008. She was a chancellor nominee of a managing council member of MUHS from 2007 to 2012. There are many, many more. She has, if you just in a LinkedIn or in a Google, if you Google her name, you will come to know what she is all about. So, without taking much of the time, Madam, welcome to this podcast, and it's a privilege of mine. Today, I have two things in mixed feelings in my mind, that I am interviewing such a great personality, whom I really always has as a special corner in my heart, and I learn, I look after that I should become a one third of you, and still I'm believing that I'm going in the same path. But I'm really tell you one thing: I don't be have that much of energy to reach to up to your level. So welcome, madam. Welcome to this podcast, and this will be throughout the Foxian's life. It will be there, and apart from your achievements, let me go into the back history of yours. So first of all, welcome you, and now we'll just give a podcast which I as a person, as a gynecologist, wish to ask you certain questions of related to your life, related to your excellence in administrative post, related to your academic excellence. So going back to your childhood, madam, I know you are come from the background of the political family. So coming from the political family background, how you choose this OBGYN field?
First of all, I'm really flattered with whatever introduction you have given, and it's much beyond my imagination, the words you were using. And right at the outset, I would like to thank the president of FOGSI, Dr. Sunita Tandulwadkar, and the vice president, Dr. Palini Appan, and Dr. Ashish Kare as the chairperson of the committee. You people are doing a wonderful job. So, congratulations to your team, first of all. And the first question you have set in, you're taking me to my childhood days. And though it was a political family, basically it was an educated family. It was an educational family, I should say, because my father was a medical profession. My mother was the then PhD of that region. And education was the passion of my whole family. So I don't think I took any extra efforts to go to a medical college, because since it goes in the family, if your father is a doctor, he always wants all his children to be doctors. So we are six siblings, and out of six, five of us are medical professions and doing excellent job in their own way.
Madam, coming back to the again the same roots, you when the only one word about the Marathwada comes, that is the region of Maharashtra, where all the biggest dignitaries, when you call as a politicians, when you call as a industrialist, when you call as a OBGYN person and the plastic surgeon of a Marathwada, only two persons names come up. That is Professor Kanan Yelikar sir and sir and madam. So, madam, what is the things that's when you're talking about Marathwada? I know you had done your MD from Nagpur, and after that, how you wish to connect to the Yelikar families, because they are coming from Aurangabad, you are from Akola. So how that
Yeah.
thing happened?
Again, going back to the olden days, I got married in 1981, and I got a lovely family, that is the Yelikar family from Aurangabad. Though in those days, the Marathwada region was supposed to be a backward area. So initially, there was a hitch in my mind, how I will be adjusted in this area and how people will accept me. Because for me, my career was important, of course, my profession was important, but equally my family was important, is important, and will always remain important. Because a simple message I would like to give to the youngsters is, at the end of the day, everyone needs a cozy, nice, warm atmosphere, and that you can get only in the family. So family first, and then your career, and then your profession. So by the time I entered Aurangabad, it was almost in 1985. I was a very junior person. I joined the department of OBGY as the most junior person, as a lecturer. And there were lot many difficulties, lot many struggles, lot many obstacles, I would say, that to go ahead, because no geographical region in our country especially, they don't like to accept people from outside. I mean, if you are from a different state, they will call you outside. If you are from a different region, they will call you as a foreigner, outsider. If you are from a different city, if you are from a different town, and even if you are from a different place in the same city. For example, Pune, I can tell you that Pate is something different, and Deccan is something different, and Camp is something different. So this is our mentality. So it took me some time to get adjusted to the atmosphere. But luckily, the department was good, my family was good. And the most important thing in a woman's life is the support of your spouse. That is very important. And I'm really proud to say that my late husband, Dr. Avinash Shelikar, who was a forward looking person in his own way, because he never stopped his education at post graduation, that is MS General Surgery. He outreach to even the super specialty in those years, and he was the first MCH of this region, that is the first plastic surgeon. So both of us, we had the same aims and objectives, sort of. So it was a little easy for me to go ahead. And he always used to encourage. He used to say yes to everything. Suppose you ask him, should I go for this conference? Yes, you can. Should I participate in this particular event? Yes, you can. And you should. And so that was the initiative, which is a very, very important thing in a woman's life. And I should say that I was really lucky, and I'm lucky that the family's cooperation or the family's encouragement is very important.
And then coming back to the one question that your husband was into the private practice and he has name fame in a private practice, how you chose your career to be in the medical college, and rightly said by you that you need to know that if I'm talking about the woman power, it has to be supported from the family and within the family. You had reached to the height where the support of the family has always been there. But what is the reason that you opt for the
Yeah.
service not in the private sector?
Yeah, usually a person after doing his post graduation, you always feel like uh, earning money by going into the private sector. But right from the childhood, my dream was to become a teacher. I never intended to become a doctor. I wanted a simple MSc or something like that, and wanted to teach in the schools or colleges. So when my father insisted that being a teacher is a good job, no doubt about it, but you should have the highest profession, and that is a medicine. Because he had already realized in his life what wonders a medical person can do. It's not only the things you are doing for yourself, but for the society. You can do so many things in the form of social services. And so he said, no, you better go for a medical profession. And then when I became an adult and I had my own postgraduate degree, I immediately chose for a teacher's job, so I could satisfy both my passions to be a teacher and to be in the medical profession. And of course, obstetrics and gynec was my first choice, because I was always wondering and I was always attached to the woman's health. When I used to see the women around in the family or in the society, I always realized that they are really downtrodden and they are not treated as they should be. So that is how I came into OBGY.
Madam, again the one question. Now you have taken the point about the teaching. Can I ask you one thing? That's because I gone through your CV and it was a huge CV to read also. I can finish it in a 1 minute, but it is a really difficult task to achieve those many. Yeah, I realized that you had done more than 1 lakh deliveries in your professional career. You have a more than 350 students to teach, Now your students become a professor, that is a different asset. I'm just talking about the huge experience about the teaching and about the OBGYN subject. I do know, madam, when you are traveling for your VP elections in the FOGSI, being a woman centric approach, because today my talk is about how the woman should be, and when I'm taking the interview of Iron Lady, I should be taking advice from her what the woman should be, and all of these obstetrician and gynecologists of our federation should take a message from you. So how that journey from the teachers?
The initial part of your question was about the teacher's life. And I tell you, teaching is a very wonderful career in anyone's life. Whether you are teaching a small toddler, or whether you are a teacher in a primary school, or a high school, or a college, or a professional college like ours. Because, see, whatever knowledge we have and imparting the knowledge to a person is a very difficult job. It's a very difficult job to get the work done from somebody else. Many a times you are frustrated and irritated and you feel like, come on, ab baju hat jao, I'll do the scissor in 5 minutes. But then that is not the point. You have to teach the student, you have to stay with him throughout the surgical skills, throughout the rest of the things, and then only the student is, trained the way you want. And as you advance in your life, as you become senior, you become associate professor, professors, and then you realize that the thing, what wonders your teaching has done, because the teaching which you have imparted to the student is practicing in the society, and so many patients are being benefited. So my knowledge automatically gets multiplied, not only 100 times, 1,000 times, but I would say endless times, because it keeps on distributing in the whole society. Now, during the teaching profession, one realizes that it's not only a teacher's job, it's a part of administration when you become a professor and head of the department, and it's also research. So, all these three wings or three parts of a medical profession or a medical teacher are there, and you have to be excellent in everything if you have to prove yourself. So, what comes with excellency is your hard work, your efforts, your patience, and most importantly is your passion. Now, a word about passion is you should learn to love your job. Then only you can put your 100% efforts. If you don't love your job, if you don't like your profession, then finished, you're gone, you cannot really progress ahead. So that was about the
Madam,
teaching.
coming to the again the teaching, the highest award of the nation you had received. So I was the witness for that particular ceremony, and I'm privileged one to attend that along with you, madam. So it's a, my first August to this August gathering is a confession that I never entered into the president's house, and she was the instrumental wherein I was the privilege to enter with her. So, madam, when you received that award, what was the future things you wish to, as a teacher, you wish to address to the those who are working as a lecturer, those who are working as a residents? For the, what is you are looking at the future things that will
Yes.
happen in teaching?
Actually, the rewards, you should not work for reward. The rewards come automatically, they automatically follow your work. So if the work is your passion, and if you work without any expectation, like, I will do this and I'll get a stage, I'll go up, I'll climb the ladder. No, it's not that way. Karmanye vadhika raste ma phaleshu kadachana. You keep on working with, in a true sense, and automatically the things come to you. I was really not aware about any sort of this award, but there are well wishers in my life. There's a lot of place for well wishers, and that doesn't come in a day, that comes over a period of time. And I do not know actually how to gather the well wishers. But if you do one good deed, one good work, one good thing, it automatically gets multiplied and the whole goodness comes to you. So, one of my colleagues had suggested that such and such award is there and you please apply. I said, I don't want to apply. I'm not interested in any awards. He said, you just gather your CV. Then one day when I sat and started writing my CV, at that time I realized how much amount of work I have done. Till that day, God promised, I was not really aware what I have done. So looking back at your own work, when you document it on a paper, the CV turned out to be 40 pages. And then I felt so proud that you have really done such a lot of work, and I could document it. And it took me almost 1 week's time. And then the application went on to Delhi, and I don't know how the scrutiny took place and all that. And then it was in the Rashtrapati Bhavan. I was invited, and just like you, that was my first opportunity in my life to be invited in the Rashtrapati Bhavan. And really, the ceremony, I will say, which took place was simply wonderful. And that was the best moment in my life. It was attended, or it was witnessed by all my family members. All of them could enter the Rashtrapati Bhavan. And after the program, the high tea which they served, my God, I had never seen such a lavish Kingsley high tea. Everything was served in silver utensils. The spoons, the forks, the plates, the kettles, the cups, everything was silver. I mean, for a moment, I felt that I have entered a palace, and all of us were the queen and the king of that palace, and we really relished that. So, that was just a part of it. But talking about this BC Roy Award, it's given for the most eminent medical teacher. So it's a very specific award. A medical, you have to be a medical professional, you have to be a medical teacher, and you need to have an outstanding work in all the aspects what I have already narrated. That is your research, your teaching, your publications, and your work in your own subject. So all that helped me putting together. I could reach that level of BC Roy. And I think that level of BC Roy has helped me to fetch many more awards later on in my life.
Madam, coming back to that award, after receiving that award, now, like I am not into the medical teaching line, but we see like my uh, children's they are wish to pursue this education, or there are the people there now. The changing scenarios are there. Where I passed out as a, from the all India, their scenario was different. Now the scenario is different. What as a teacher you're looking forward? What should be the change, and what is the things that has to be done in a medical profession, that our medical profession becomes the number? It is already been recognized in the different countries by our skills and everything. But what is your as a teacher should be one of the guidance to the government, where you can likely to say some few suggestions.
Remember one thing, that doctors are not gods. Doctor is not a god that you have to explain to all your patients. But definitely, you are a savior. You can really save so many thousands of lives. And the things now are becoming little different because the whole society has changed. The norms have changed, their ethics has changed, and their principles have changed. So really becomes little difficult for any junior person to come into practice and start the practice, because starting a practice, there are, I think, more than 50 certificates which you need for the nursing home. And there are so many norms. By the time you fulfill all those norms, you are already exhausted. And even if a small mishap occurs, the patients will always hold the doctors responsible, which is not true. There are inherent complications with all the conditions which we have been learning throughout our life in the medical field. So these complications and mishaps due to these complications have to be explained to the patients right at the beginning, and they should be aware about it, and you should inform them well in time. Now, regarding the medical students, I still feel that a medical profession is the highest profession, because it is not only a decorative profession, but in the real sense, you are a God's messenger, because you also must have realized in your own life that what happens to an infertile couple, the happiness which you see on their face once they have a child, then those mothers who are dying mothers, and you save their life, you feel satisfied. So that internal satisfaction is only in a medical profession. So I will rate the medical profession as the top profession amongst all.
Okay, madam, coming to another side of yours, when you become a dean and you taken a charge as a dean, and after that the COVID comes in, and you are the person who make the guidelines, you make the savior for thousands of the lives as a dean of the medical college, wherein there are the people who are not feel comfortable for serving our own society, being a doctor also in a private setup. So being a institution and being the government and see government agency, I personally know that you had made some protocols. You are the instrumental one who has a direct contact with the health minister of that particular period of time. So, madam, how you handle that kind of a pressure and in those particular era?
Now, talking about the COVID pandemic, it comes once in 100 years. And I think that was a golden opportunity which God had given me to prove myself during that crucial time. So I took COVID as a challenge in through that perspective. Now, when I became dean, that is the highest post in any medical college in the administration, I was posted in Nanded and I was the first woman dean. People literally used to come to see me how a woman looks like in the chair of a dean. Then same thing happened in Aurangabad. I was the first woman dean in the Aurangabad Medical College, and here also people are not really very comfortable with a woman administrator. The ego of the man comes in between. Men or no man would like to work under a woman, and that is the first hindrance in your working pattern. So you have to make yourself comfortable in the chair, you have to make your surroundings comfortable, you have to make your colleagues comfortable, and I mean you have to make those junior colleagues or the male colleagues feel comfortable that there should be no difference, and I'm just like you, I'm just promoted. Only the chair has changed, but I am the same one. What I was yesterday. So that comfort level gradually increased, and the things became easy. Now talking about COVID, it was 2020 that the first patient of COVID was reported in our city, and it was a havoc because no one was knowing what COVID is, what is the route of spread of the disease, and for how many days it will remain, whether it is a self limiting. How do you diagnose? The detection of COVID itself was so difficult. So many tests were coming and going, and then the lab had to be set up. So the challenges were from all these sides. The patients were increasing day by day. We did not have enough oxygen beds. I'm talking about the first wave. And uh, what helped me during this COVID phase was quick decisions. My father, during my childhood, had once taught me that decisions and quick decisions are important. Not taking a decision is a crime. Whether you are right in your decision or whether you are wrong in your decision, it will be a retrospective diagnosis. The time will prove whether you went wrong or whether you were right. So, taking decisions, timely decisions, really helped me to curb this COVID. And administration as a whole, I would say that the health system in the state of Maharashtra really worked wonderfully, including all the secretaries, all the ministers, and whatever help we could get from the central ministry was really wonderful. And within a span of 3 to 6 months, we could increase the oxygen beds from 150 to 1000, and the ICCU beds, there were hardly 20 ICCU beds in the medical college, and we had to increase it to 200 ICCU. I mean, by ICCU is the ventilators. So we had realized that this is a respiratory infection, and people in the terminal phase they need ventilators, that is respiratory support, and the ventilators even today are manufactured not in our country but outside our country. So, importing and getting those ventilators in time was a big challenge to our government. And I said that the government of India has really done a wonderful job during that period. And that is how we could curb the COVID pandemic.
Madam, I will ask you one thing that whenever you are a obstetrician and gynecologist, you are very much quick in taking the decision in the table inside the OT or during the labor. But whenever there is some supreme authority on your top, that is the health minister and secretaries, taking their phone calls when your mind is something else, and is there is a incidence which has happened with you that certain decisions without your mind saying yes to it, you had been taken or something
No,
is because all of us
no.
are not trained into that. It's
And
not
no,
happening.
it's not a question of who is taking the decision. It's a question whether it was a right decision or a wrong decision. Let me tell you that administrators were not doctors. They were experts in their administration. So they always respected the decision of the doctors.
Yeah.
And let me tell you, when we attended the video conferences right up to our chief minister, honorable chief minister, all the ministers and all, they literally pointed out at me as the Dean Aurangabad, and they used to appreciate my work. They didn't remember my name, but they definitely remembered that there is a woman dean in Aurangabad sitting there, and she has got her own innovative ways of dealing with COVID. And they used to respect my decisions and my opinions, and not only with the higher authorities, even at the local administration, that is the honorable collectors, the commissioners, all of them, they always respect doctors. The only thing is you should have a good counseling skill.
True.
You need to counsel them properly.
Madam, again coming back to your dean tenure, you was a dean in a Nanded Medical College, and you are the instrumental one who has saved, and you has the big news come in a newspaper, that is Green Corridor. The Maharashtra has not seen the Green Corridor yet, and the Marathwada is like, especially you are the first one, being a female. What is your how the things work? Because we know nowadays Green Corridor everything is, but that particular time, that thinking of that side, because taking the organ from the one person into the helicopter, transporting to the some place, I think it's a huge, tremendous work and administrative power. So can we have something about it? Because that was the first one.
I think the professional skill and the political will is what we need to implement certain things. For example, at that time, our health minister had a great thing in his mind, and that was about organ donation. And everywhere we were trying to preach and educate people about organ donation, the importance of it. And during that time, 2016, we had a one brain dead patient, and I got a call in the middle of the night, that is at 11 o'clock, saying that, Madam, we are having such and such patient. Should we plan for the organ retrieval? I said, do you feel that our team is capable of it? So the professor of surgery is supposed to be the main person in that, and he was very confident. So at that time, you have to believe your juniors and your colleagues, the ability of them and the capacity of them. And once you delegate the work, I think they do a fantastic job. You don't have to be anywhere in the picture. So the team started working on it, and I that was my first experience. And literally throughout the night, the team was sitting with the computers, internet, and all the investigations of the patient. And you have to inform the ZTCC, you have to inform where the organs are required, you have to take the consent of the family members, which was a very tough job. But the family was also educated, and they had already decided about the organ donation. And that is how it all happened. Then we had to give a call to the recipient, and that was in Mumbai. They needed a heart in the Fortis hospital. So we had to arrange for the green corridor, and the police commissioner was very, very cooperative at that time. And within 2 to 3 hours' time, the green corridor was prepared, and the organ retrieval procedure started in the morning at around 9 o'clock. And by 10:30, the organs were literally parceled in the container,
The photographs.
and that container was beside me in the Innova car, and I was a part of it. And the heart was there. It was silent, of course. They paralyze it. It's not a beating heart in the container. And then we literally at the speed of 150 kilometers per hour. That was the speed of my vehicle. And to my great surprise, one cow came in between, and the driver also had to be a very super driver. He literally saved us. He took us to the airport, and the surgeons with the heart, they flew. And in the evening, when the surgeon called me that the transplant was done successfully and the transplanted heart started beating, that time I heaved a sigh. Yes, the thing was successful. The kidneys were, of course, transported to Aurangabad, from Nanded, the heart to
What is
Mumbai. So it was. very tricky situation. But I think you should have a strong belief in God, and He is always there to support you.
Madam
And if your
Sunita,
mind is clear and then your motto is clear, then He is also ready to help us.
Madam, I've seen many times, we come down to the organization side now. You had served in a medical college as a dean, from the HOD to the dean, and then different administrative posts. When it's come down to the organizations, our OBGYN, you have given us so many lectures, so many workshop. You have your own things because you innovations in obstetrics and gynecology. I seen you a fantastic vaginal surgeons, a non-distant vaginal hysterectomy. I attended that workshop with you, madam. I seen the skills, and then one day you started your journey into the organization. That is what we are interviewed today as a FOGSI. So you come up as a committee chair in a clinical research. And after that, you stand for the vice president. You come up as a vice president. Madam, when you are in a post of any organization, I seen your dynamicity. I seen your what you just now talked to us. The decision has to be made at that particular point, and there is no point that you should delay it. I've seen many Foxy meetings wherein you raise your voice for the correct things of the Foxians. So I just wanted to know from your side, what is your vision? See, if suppose like a grassroots workers, like any of us as a obstetrician, wish to become a Foxy president, you fought the. I think that is the. I think one of the election to remember, because he is the intellectual person, he is the endoscopic person, he is the IVF person, and the another person standing against him is, she is the excellent orator, excellent academician, excellent networking, excellent a thorough academics, and nothing about anything else. So madam, what is your view about the organization views and how the organization should lead to? Because I do understand your now daughter, she is also a capable of as a good leadership quality from you, and now she is a joint secretary of this organization. So I think it comes in a blood. So let me ask you, what is the genetic formula of it?
Actually, my first exposure to Foxy was way back in 1983 when I was a postgraduate student and I presented a paper in the conference. And those days, presentation in a conference was a very unusual thing and no one liked it so much. But I was very keen to attend at least one national conference. And the conference was held at Madras. It was called as Madras in those days and not Chennai. So, and the slides were all black and white, no PPT, nothing. We had to move the slides one after another. I don't know how many of you have seen those slides in your life. So, all that was a very difficult part. I had prepared presentation on postmenopausal bleeding, and then it went on very well, and of course I also got the prize for that. So that boosted me that if you enter this organization you have got a very good future. And there were real academicians in those years surrounded, and when I listened to them, their orations, I was so fascinated that Dr. Das Gupta was there, Dr. R.D. Pandit was there, so many of them I can name. Dr. Purandare was there. So all of them spoke so well, and therefore I got attracted towards Foxy. And the first conference which I organized in Aurangabad city, we had no, I mean, view for or vision for any conference in our city. So in 1988, I don't know now, it's almost 40 years back, that I organized a small CME and I had invited three people from Mumbai, and we organized on fetal well-being. Imagine in 1988 when even ultrasound machines were not
Okay.
available.
We are
The
still
first,
now thinking of the fetal medicine. That time you
yeah,
thought of.
the first ultrasound machine was in my medical college, and we knew nothing about it. We could see only black and white images. Whatever was moving, we thought is a heart. What was having a gross movement was a hand. So, like that, we learned ultrasound. And of course, I had to say that you should have a passion for your subject and you should never remain ignorant about your subject. So, immediately, the same summer season, I went to Mumbai, to Wadia. I had a 40 days training in ultrasound, and after coming back there was no looking back at that. So this is how the journey started, and the CME went on very well. So the people in Aurangabad became enthusiastic. So if you want to go ahead, you first have to organize your local organization. And I'm really happy about Aurangabad society. At that time hardly 20 members were there, and now we have crossed almost 200. So you can see 200 times we are going ahead, and all of them are very cooperative. Even today, they respect my opinion. So this respect has to be commanded. You cannot demand it. And for that, you have to do a lot of hard work. And that is how gradually we then went into FOGSI, into AMOX, and then it also gave you the results. I could see that once you enter the organizations, you can do lot many things for women's health. And I'm really thankful to the organization like FOGSI and AMOX. They are giving platform to the beginners. They are providing platform to the most intellectual persons, and it is a platform for exchange of knowledge. So always when you come back from a conference, while coming back or traveling back, you have to revise what you have learned new in this conference. It's not only going for enjoyment. It has to be a purely academic conference, and that is how I went ahead.
Madam, coming down to the now you are talking about the traveling, and today's session is a woman-centric session. So, being a Aurangabad, it is not that much connected by the flights or maybe from the railways. How it is difficult for the woman to travel and to attend so many workshops, so many conferences, being a VP of the FOGSI, and then into the AMOX as a president of AMOX. How the journey was, and is there is any struggle while coping up with that particular expectations? Because nowadays the president usually or vice president usually travel to certain conferences, not all, but your time I think it will was the difference. So how you maintain that things with the health?
Yeah, actually, time management is my favorite topic, and I must have lectured more than 50 times or even 100 times on time management. So, to achieve anything in your life, you have to utilize those 24 hours differently than what the others are utilizing. So, if you understand the importance of time, you can achieve lot many things, and you have to allocate time to your executive time, that is your working time, your home time, then your own study time, and then the social time, resting time. So all, if you distribute the 24 hours, I think it becomes very easy for you to plan whatever you have to achieve. And the most important thing I learned is utilize your travel time in studying or whatever you want to do. So I never wasted time even during the travel. So those days laptop was not available. A small laptop I had purchased, and that gave me a lot of boost in my life. I could prepare my lectures at the airport waiting for the next flight and all.
Madam, now coming down to your home time, just now you mentioned about the family time and home time. I do know that you have a one son and daughter. From their childhood, they was excellent badminton players. They had been traveled to the different one of like your child Ashwini. She is a national player along with the Aditya. So how you taken that much of time being a mother, being a organization head, being a into the HOD or maybe a unit head? What is the secrecy being a woman handling so many things at a time?
अष्टभुजा मराठीमध्ये म्हणतात. So a woman is really having 8 hands. She is working so many things. Multitasking is her, I mean, a favorite terminology nowadays for every woman. And I would say that every working woman has a guilt in her mind that she is not giving adequate time to her family. So, first of all, every woman should remove that guilt from her own mind and try to give as much as time possible, especially to the children when they are very small. You have to be available at their time. So, availability of a mother in the home is the first basic thing to bring up the children. Nothing else. They don't want any expensive things. They just want you to be around them. So, being in a government service, that was an advantage for me. Whenever these children had their exams, I used to be on leave for 1 month, say for 10th or 12th. So, I was with them. They used to study, I used to teach them, or only be with them. And even for their badminton games, I used to get 3 to 4 days leave, and I used to accompany them myself. I am also a sportswoman. So, I loved that game, even to watch it. And once upon a time, all three of us were playing, and I was a district champion also in women's single. So, physical fitness is very important to have a mental fitness. And a woman's health is not only the physical health, it is the mental health, it is the social health, it is an emotional health, and also spiritual health. So, if you have all these things in the background, I think a woman really flourishes the way nature wants it. It's not I or you who decide what we should become. It's the nature, and nature has already decided for all of us what you will achieve, what you will get, what I am going to achieve, or what she is going to achieve. So that way, and family time, as I said, is always very important.
Madam, what is your favorite things that, because now entire of your family is doctors. Your son is excellent neurosurgeon. Your daughter is an excellent IVF specialist. So what is that genetic formula in your family that everyone is doctors from the generation to generation? So what I think Marathwada and entire nation should know, what is it? Why everyone wish to be in that league?
Actually, it's not the wish it's not the wish of the child. Actually, when the child is in the 10th or 12th, he's totally confused. I don't believe nowadays parents are saying, no, no, my child doesn't like medicine, he just wants to be this, he just wants to be that. But the child at that age is really confused, and the parents have to guide their career, what they should. And you should know the aptitude of your child, you should know the attitude of your child, and that helps you to decide, yes, she will be a good doctor, he will be a good doctor. And as I told you, my personal opinion about my own profession is the medical profession is the highest profession as and now, and even for years to come back. And therefore I respect our own profession. And I think that's how the children also got that environment in the family. They used to see me going to the hospital. I used to carry my children to the labor room also when they were very small. I used to make them sit in a side room. They used to do their homework. I used to complete one delivery, come back. My children used to say, Mom, your sari is stinking of that labor room liquor. So, I mean, they were also involved with me. And during their exam times, they used to come to me and watch. And the children should watch how much hard work your parents are doing, because we usually don't show them what we are doing, and we always want to be goody goody to them. See, I have provided this thing for you, I have purchased such a nice thing. But you have to also make them realize that the parents are also working very hard, and what they have achieved is not out of the way, but it's out of their hard work. So I think that is how the children also very inclined to become doctors.
Madam, coming to the now the grandchildrens of yours, you specially make an attempt that you make a whatever busy you're coming for a few hours. You make sure that you come and you meet them, and you they feel a something a special bond to you, though they are away from you. The Aditya's like families are there, but your daughter family has not been there, and your first is a granddaughter you had. I seen more your friends are much more friends with the with your granddaughter. So how that connection of a grandmother you look as it, because you
I
change
think,
now your
yeah.
paradigm from the family to the professional excellence to the achievements that your daughter and son they had excellency in their field. So how that again the time comes to you.
I think that is the highest happiness in a woman's life, to become a grandmother. It is very well said that the child gives birth to the mother. Are you getting the meaning? So once a childbirth occurs, the mother is born. So you should be happy, and you should have a feeling that because of your children you are a father, because of your children you are a mother, and because of my grandchildren I am a grandmother. I could become. So that bond is natural. It doesn't has to. You don't have to develop anything. It comes from within. And one part I would like to confess in front of everyone, that I am also passionate for cooking. In spite of my busy hours, I like to be in the kitchen. Even today, I spend at least 1 hour in the kitchen, though you have so many servants to cook. But the mother's hand, or the food which you prepare, has to be. I still believe that the emotions and the feelings and the bonding goes through the food And if you really provide good food to your children and their grandchildren, they are very happy with you.
Madam, coming to again the vision for the as a woman, for because we have only 5 minutes now.
Actually, it's a very huge topic and a very sensitive one because there are so many themes. The themes come, the themes go back. So many days are celebrated and nothing happens. Actually, the basic thing about a woman's health in the family she should receive, and the importance to her opinions, whatever that the nutrition has to be proper, because unless the nutrition is good she cannot have a physical fitness. Then she also needs to have good rest, she has to be emotionally balanced, she has to be de-stressed. The job of a spouse is to de-stress and not increase the stress of the woman. So in that thing I was really very lucky. Dr. Avinash Shelikar was a क्या बोलते हैं उसको,
वो एक आपका पूरा आधार स्तंभ थे.
stress management. He used to de-stress me in any situation, whatever difficult situation. So that is the first thing. And women's health, they need a screening. The most important thing is anemia in our country, and so many complications are occurring. In my days I had seen transverse lie, hand collapse, rupture uterus, but thanks to our all the obstetricians that we are not seeing these complications. And the scenario in a woman's health is changing now over a period of time, especially when you look at the reducing maternal mortality rate in our country, and especially in the state of Maharashtra. I feel that the women's health has a good future in our country, and very little has remained now to do for them.
Okay, madam. The last question from my side. What we will be looking as a Dr. Kanan Yelikar in the future? Maybe a political leader, maybe a health policy maker, maybe a minister of health, or maybe the person, because you achieved everything, madam. There is nothing that is been left out apart from this. Because what I mentioned these particular things, because if you are into that position, your huge work, experience of those work can be implemented for the upliftment of the womanhood. So, madam, where we can look forward?
Actually, first of all, I'm really thankful to God for giving me so many opportunities and so many successes, I should say. Whatever you require in a lifetime, I think I have done with it, and I don't have any more expectations from the society or from God. Now, whatever little knowledge I have to impart it to the society, and therefore I have joined a new medical college again as a dean at this age after retirement of 3 years. Now, I shouldn't be telling my age, but I'm almost nearing
What is
70
the
now.
raz of your health? All the time you are the same, looking the same. We can have the photograph of 10 years back and now also.
Yeah, the Raj is little genetic. My grandmother was like me, and I am like her. She never turned old anytime. And secondly, is your good diet, sleep, and physical fitness. I still have my 1 hour of workout every day. And that is my message to all of us, that you should be physically fit. So, physical fitness and mental alertness, they not only go hand in hand, but they go hand in gloves. So if you are not physically fit, for example, even if you have a small headache, you cannot do any work. So you have to be really careful about your physical fitness.
Thank you, madam. Thank you very much
Thank
from the
you so
side of
much.
the Foxy, and
Yeah.
we are really happy to have such a eminent speaker. And I'm really thankful to you for
Yes.
being there and taking us so much of time for us. The only things that our podcast who are like those people who are watching us live should remember that the one person from the Marathwada comes to this level, any obstetrician and gynecologist can have the vision. What Madam actually said, that the woman position in the family starts the respect from that side, and whatever the need is required is the support from the family. If it is good, then you can climb as much as high and more than the limits you can cross. So thank you, madam. Thank you for being there.
Thank you. Thank you so much. Bye.
Thank you. Thank you very much.